Hi, my name is Corinne, and I will be your nurse today. And I will be here just talking to you about your recent diagnosis. And I will be getting a brief physical and then a little bit about your family history and your personal health history. To get started, how have you been feeling lately?
Yeah, so I've been feeling super fatigued lately. I've also been having numbness and tingling in my right arm. I've also been having ringing in my ears. I've noticed lately my vision has been blurred. Also, for no reason, my eyes will shake back and forth. And then I've been having migraine headaches. And I've also been having restless leg syndrome. And sometimes I have a hard time finding words.
Okay, with all of these symptoms that you've been experiencing, how's your everyday life been?
Super stressful. I feel like I'm anxious all the time, especially with this new condition. I've heard that it's super expensive for medications, so that's super stressful. I don't have a lot of help with the kids. My husband works all the time. I feel like I've been giving up a lot of social events because I've been tired. There's a lot of fast food in the house frequently, and it's been very messy around the house. It's been hard for me to keep up with the cooking, cleaning, and the laundry, so that's rough. And then, yeah.
Do you have any help in your social life with family events or like watching the kids?
I mean, I'm involved in my church, so I guess I could ask for help, and then I go to my kids' sports events a lot, and then I commute to work 30 minutes each way.
So with your new diagnosis of multiple sclerosis, what do you already know about the disease?
Well, like I said, my grandma had it, and I do know that it's autoimmune and that it's not curable, but we can treat the symptoms.
Okay. Is there something that you would like to learn first?
Yeah, I would definitely love to learn about medications and the costs and any resources that you might have for me, because it is expensive.
Okay. I do have this pamphlet that I'm going to give you, and it has a lot about medications that you'll probably be prescribed, and you can look through them and see how much they are and what they do. And then we will also show you a PowerPoint about these medications as well.
Okay, cool. Thank you.
Yeah. Okay, so we're going to be talking about your condition today, and it is an autoimmune disease, as you already know. It disrupts the communication between cells. The body's immune system attacks the myelin sheath of your neurons, and over time you'll have a decrease in motor function. As you already know, this disease is not curable, but we can slow the progression of the disease and manage symptoms with medication.
Okay, cool. So are we still going to go over medications?
Yeah, we will. Before we do that, I am just going to explain about the disease process a little bit further.
Okay, thanks.
Some of the clinical manifestations of this disease are characterized by the chronic deterioration of the disease. There will be some points in time where you'll feel a little bit better, and then there will be times when you'll have exacerbations of your symptoms and things will be a little bit worse.
What are exacerbations?
A worsening of your symptoms. It's like a flare-up.
Okay.
So some of the signs and symptoms that you're experiencing are determined by which areas of the central nervous system that are being affected by this demyelination of your cells. And in the future, you may have some cognitive and speech difficulties as the disease progresses. Okay. And some of the signs and symptoms that you'll experience with this disease are the visual issues. I know that you've been seeing an eye doctor, and so you'll want to keep seeing that eye doctor at least once every 6 months. You'll probably experience fatigue, maybe some depression, an unstable mood, eye nystagmus, and that's what you were telling me a little bit about. Dysphagia, which is just difficulty swallowing, and then you'll also experience tingling, burning, or pins and needles, or feeling of pins and needles, a lack of muscle coordination, and changes in urinary frequency and how long you're able to hold in your urine. With that, you might have constipation or diarrhea. Okay, now getting into the medications, the interferon B1A, also known as Rebif, it decreases the severity of attacks and it delays the progression of the disease. This is a medication that you will have to take for life, and side effects are liver injury, and you will also want to avoid pregnancy while taking this medication as it can be harmful to the fetus. You'll have to take this as an injection 3 times a week, and the retail price of this medication is pretty pricey, as you'll see that many of these medications are, but at the end of this PowerPoint, I'll tell you a little bit more about how you can have help with the medication costs.
Okay, good, because that's a lot of money.
Yes, it is. For the verapamil, it's also known as Isoptin. It's a calcium channel blocker, which treats hypertension, chest pain, heart arrhythmias, which is just an irregular beating of your heart, and migraines. And the side effects of this medication include edema, hypotension, indigestion, and dizziness. You will have to take this at night and in the morning, and the average retail price of this medication is around $20.
The next medication is tizanidine, also known as Xanaflex. It's an alpha-2 adrenergic agonist. It's a muscle relaxer, so it'll help relax the muscle spasticity that you've been feeling. And some side effects are hypotension, liver injury, and you could also experience hallucinations and some psychotic type symptoms. And the average retail price is about $16 for this, and you'll take it every other day? Twice a day?
With a lot of these, I noticed that there's like risk for liver injury. Is there anything you'll do to monitor for that?
Yeah, we will actually just check your AST, ALT, and so in 3 months you have a checkup, so we'll be checking up on those labs. This next medication is clonazepam. This will treat the anxiety that you've been feeling. It's a benzodiazepine. Some side effects you may experience are drowsiness, tiredness, loss of coordination, increased saliva production as well, and the average retail price is $14.
And the next drug we're going to discuss is vilaxifene.
This is also known as Effexor, and it's a CNS stimulant, so it will treat depression. Some side effects you may experience are decreased libido, loss of appetite, and constipation, and you'll take this every night. And then also another medication to treat your restless leg syndrome you were talking about is ropinirole, also known as Requip. It's a dopamine agonist, and hypersensitivity, trouble falling asleep, and hypotension are some side effects you might experience, and you'll take this twice a day. Gabapentin, this is an anti-epileptic drug. It will treat neuropathic pain. You will experience increased risk of seizures, severe weakness, problems with balance, and you could possibly experience upper stomach pain, and you'll want to take this twice a day as well. Amantadine, it's a synthetic cyclic primary amine, treats the flu-like symptoms you may be experiencing, and some side effects are dry mouth, constipation, and confusion, and you'll also take this twice a day. And here's some supplements we're gonna talk about. This is the iron supplement. This will treat iron deficiency, and you could possibly experience constipation and stomach upset.
The next one we're going to talk about is calcium. It's help for calcium deficiency. Some of the possible side effects are hypocalcemia and muscle spasms. And with all of these supplements, they're help to facilitate some nutrients for you and hopefully help relieve some of your symptoms and exasperations. The next one is vitamin D, and some of the possible side effects from taking vitamin D could include headache, sleepiness, dry mouth, and a metallic taste in your mouth. And one of the ways to avoid the metallic taste is by drinking a full glass of water when you take it. And lastly, the multivitamin, and some possible side effects with this are discoloration of your urine, an upset stomach, or possible constipation.
And as we talked about earlier, you want to continue seeing an ophthalmologist every 6 months. If there are further drastic changes in your vision, you'll probably want to see them sooner. You'll want to see a speech therapist, and a lot of people think that speech therapy is just to formulate words, but not only will they help you with this, they can also assist you in swallowing. So as your disease progresses, it will become harder and harder to swallow, and that can become a risk for aspiration, and you will want to make sure that you're as safe as possible with that. You'll also probably want to look into some counseling. It can be really helpful if your partner knows about the disease and you guys are on the same page with your care and how you guys can help each other out emotionally and physically. And then you will go to physical therapy to help with your disease progression again. You will find that some activities of daily life might be harder, even just like going up the stairs or walking into your garage. There's specific tools, and there are different activities that can assist you to make that easier. And then also water aerobics with physical therapy is extremely beneficial. It takes off a lot of stress on your musculoskeletal system, and so that can be really beneficial as well. And then occupational therapy will also be helpful, just as helpful as physical therapy. There are a lot of things that might not seem super intuitive, but then once you learn them to help you with your activities of daily living, then it will just greatly improve the quality of your life in living with this disease. You'll want to talk to case management. They can help you with the cost of the medications. They can refer you and help you with your insurance, and they can talk to you about what your insurance can and can't cover. And then you'll want to talk to a dietitian so you can have the proper nutrients while you're learning to live with this disease. And what do you feel like you learned from the medication information that I gave to you a little bit ago?
I feel like I learned a lot about the medication side effects that I didn't know would be a thing, so I think that's helpful in living day to day, and if I notice things are changing, that'll help me to know that.
Good, I'm glad that it was helpful.
Yes. Also, I'm curious, you did mention earlier in the presentation that you said you had a resource that would help with some of the medication costs.
Yeah, so there is a really neat website. It's called goodrx.com, and it is a website where you can type in your medication and your dose, and it will give you coupons for your medication that you're taking.
Okay.
And these coupons can be anywhere between $2 to $1,000 off of your medication.
Wow.
Yeah,
Okay.
so it can be really helpful.
Okay, and then you'll get that to me later, the
Yes.
website. Okay,
Yes.
cool.
So right now, what do you think a good goal for you that would be realistic what do you think a good goal would be that we can set right now so you have a something to move forward with after this appointment?
Yeah, I think I'll try to make a case management appointment in the next couple of weeks, within 2 weeks, just so that way I can get some help financially or get some assist with that.
Good. Well, I'm really glad that you came in today,
Yes,
Um,
thank you.
and I hope to see you soon in your follow-up visit.
Okay, 3 months, right?
Yes.
Okay, perfect, thanks. I've just been super fatigued lately. And this is Venlafaxine.